Right, so this one's about something called communicable diseases. So let's just quickly talk through what that means. If you look on the left, you can see a picture that represents, or is meant to represent, a heart attack. If I had a heart attack and I came to work the next day and we were having a conversation, you're not going to catch a heart attack off me. So that's not a communicable disease, because a communicable disease is one that can be spread. For example, if I came in and I had the flu and we were having a conversation, well, you might catch that off me. So the question is, well, what are you actually catching? What you're catching is a pathogen. And a pathogen is a microorganism that causes an infectious disease. So it comes in different types. So it could be, for example, a bacteria, a virus, it could be fungi, or it could be something called protists. And for each one, you need to know a couple of examples of the disease each pathogen causes and what the symptoms are when you have that disease. So what happens to you when you have it. So let's quickly run through them. So these two diseases are caused by bacteria. So Salmonella is caused by uncooked or unclean food, and if you have Salmonella, you're going to have a fever, you'll be vomiting, and you'll have diarrhea. Gonorrhea is a sexually transmitted disease, and if you have that, it's not good news for you, because you'll have a yellow or green genital discharge, and you'll have pain when urinating. Sometimes people try and be polite and say pain when going to the toilet, but it's specifically when urinating, so just say when urinating. You could stop this by using a barrier method of contraception, like a condom, right? Anything where there's a physical barrier between the sexual organs of the two people involved, right? So being on a contraceptive pill, for example, won't stop that spreading. These three are caused by viruses. Now, two of them have V in the name, so that's kind of handy for you. There's HIV, which is a disease in which is spread through bodily fluid. So it's not just sexually, it could be through blood, for example, or through sharing needles. It causes a flu-like illness, and it will gradually destroy your white blood cells. So basically you end up with no protection and you're very vulnerable to all kinds of other diseases. TMV stands for tobacco mosaic virus, and what happens is it infects plants and it gives them a mosaic pattern, a kind of spotty pattern like you can see on that leaf. Because that leaf isn't green as much as it could be, it can't photosynthesize in those areas, so it can't make as much glucose, it can't grow as much. So infected plants seem to be, or tend to be, a little smaller. And the last one of the viruses are measles. So if you have measles, you have a red skin rash. It can spread through sneezing, but you can get vaccinated and that will make you immune, meaning you can't catch it, or at least you can't get ill. Last two, and the first one is a fungi. So clues in the name, rose black spot. It will infect plants like roses and you'll get a black spot. Again, those leaves can turn yellow or fall off, and those areas can't do photosynthesis, so they might end up smaller because they can't make the stuff they need to grow. And lastly, a bit of a weird one, protists. That causes a disease called malaria, which is spread by mosquitoes. You can say that the mosquito is the vector. It's the thing that helps carry it around. It causes a fever, and it can be fatal. The sad thing is it's very easy to stop it spreading with mosquito nets and things, but the people that need it most can't always afford it. So there are your diseases. There were two by bacteria, Salmonella and Gonorrhoea. One with a fungal pathogen, rose black spot. One with a protist for a pathogen, malaria. And there were three for viruses, measles, HIV and TMV.